Hi. So I know it's been like 2 weeks maybe, since I did my last video, and in the last video I talked about what we were able to find somewhat local with Fred Hutch in Seattle, the Tri-City Cancer Center, Spokane, and then in Utah. And then um, and then just to summarize, the standard of care was the same. He's so smiley. It was the same care that my mom, because we have the same type of cancer. The standard of care for our specific type of cancer in basal ductal carcinoma hadn't changed in 15 years. And that didn't work for her, and so that's why we were looking for something more, like a more integrative approach, different means of administering chemo, or just a different type of chemo to try. Um, and then we were kind of found that at Fred Hutch in Seattle, but not really. And then how we found out about Invita was we were at a barbecue at our neighbors who are our friends, and they knew somebody who was receiving cancer treatment at Invita in Arizona. And then so we Googled them, and they also claimed to be an integrative cancer center, but what was different was just even from their website, it listed all, like, their whole, how they administer chemo, the different types of, I guess, their type of radiation, the different types of radiation that they do, because it's not just, Donovan, what type of radiation does standard of care chemo do? What is it? Heat? Is it like what? Is it nuclear? Yeah, they use nuclear radiation. Whereas here they can do sound, they can do heat, they can do freezing, they can do electromagnetic frequency to explode the cells. And that's all just listed on their website. And so what was really affirming to us, because all the other places that we had gone to they said they were integrative, and what that meant was like acupuncture or like ginger tea for your nausea. And it's like, this is not the side effects of the chemo that I'm trying to avoid. It's the long-term, like, neuropathy in my feet for the rest of my life, damage to my heart, because I'm 31 years old. I don't just want 10 years. Like, I'm hoping for like 40, or 50. Like, I don't want to spend those years with severe side effects if I can avoid them. And then I make an appointment with Invita, and they are very upfront about cost. So the biggest difference is, I don't know for Arizona if it's right to treat or right to test. So what that means is the patient and the doctor can tailor it to the patient. They're not confined to the exact stipulations and dosage set by the FDA and the insurance companies. They can tailor it to the individual. And what Invita does is they actually test your tumor cells against different strands of chemo and a different known properties, like green tea extracts, aspirin, like ivermectin, like all these different things that have studies are coming out and saying that they work against cancer. They test your tumor against it. So you're not having to go through the guinea pig. They grow your cells and then test it against your cells, which can save you time when time is already pretty short. And also the things that in meeting with them, because I did a consult with them, the chemo that Fred Hutch was going to do, they were going to give me two, which is what we liked about Fred Hutch. And then the instead of just relying on MRI imaging halfway through my treatment to see if it's working, they do the circulating tumor DNA and tumor methylation score from your blood, every 3 weeks to see if that's working, which is what Utah was doing. So it combined everything, all the clinical trials that were working to get FDA approval so insurance companies will pay for them, they were already doing. And one of the biggest differences that they do too, and the reason why I still have hair, is they do microdosing of chemo. And so instead of like once a month getting a huge dose of chemo, they do microdosing. And how they're still able to get results from doing that is it's kind of like when you think about a PET scan. For a PET scan, you have to be fasting, and then they inject your body with radiated sugar. And so the tumor is some of the fastest growing cells in your body, and so it sucks it up. And so that's why a PET scan works, is because when tumors are hungry, they take the first serving of food. And so when Envita gives you chemo, they drop your blood sugar, and then they administer while they're dropping your blood sugar through insulin, they then give you your chemo. And if your chemo is compatible with sugar, they mix the chemo itself with sugar. So then your cancer is sucking up the poison, and your body's getting a lesser dose of that poison. And then that's done once a week. And that's why instead of doing like the traditional chemo port, which is just like a bump right there, I'm not wearing the best shirt for this, I have these 2 dongles, which is nice because I don't have to get any poked at all once this is installed. But this one, they're watching my blood sugar to make sure it's not getting too low and it's staying where they want it, so it's safe. My mom went to a place that did not do that, and she was got in a diabetic coma for a little bit until they were able to get it back up. So that was scary. So really glad that they're really safe and take precautions. And then this one, they're administering the chemo. So this one's blood's coming out, this one it's coming in. And they also do that. They also do like ozone therapy, where they take my blood out, oxygenate it, put it through a UV light to also kill it. It's also for like keeping my immune system healthy, so I don't have germs. And also like cancer doesn't like an oxidative environment, so that's also another means. And then Envita also tries to figure out why you got cancer in the first place. One thing that was comforting but also slightly frustrating is like I didn't have any like people was like, oh, do you have the BRCA gene? I do not. And there's also like other genes that are associated with breast cancer or cancer in general, and I don't have those either, at least not that they have found yet, because obviously my mom and I have the same type of cancer, so it would make sense that there'd be a genetic component, or at least a genetic sensitivity to estrogen. But didn't have any of that, but my mold, and I had a couple heavy metals that were high. And so they can actually filter your blood by apheresis and pull that out. So that can help my immune system. And then it also helps at the end. They can do that too to help. They do it at the end because they don't want to pull out the chemo right now, because they're trying to have that systemic effect with the chemo. But in addition to their microdosing with chemo and combining it with sugar, one of their main modalities that they do, and the one that they have a patent on, is called CIPI. And that's where they actually inject chemo, the chemo that's proven to be difficult on your cancer. They actually inject that into all of your tumors and to any cancerous lymph nodes. And so I had that done recently. And that helps. And then by doing that, they don't just inject chemo, they also take out your blood, and they isolate this one protein that's supposed to activate your immune system, and they inject that back in. So when you first show up, they take like 90 cc's of your blood and then pull out those proteins, and then when they mix that with the chemo, and then they also it was a drug designed for like skin cancer, because it flags your immune system and lets them know that they need to attack this. It's like a red flag for your immune system, and they mix that, make a nice little cocktail, and then they inject it into your all your tumors. And in doing that, they also cut off the blood supply to the tumor, which helps it kill that way. And for me, I'm actually doing this procedure twice, I did it this week. Well, last Friday, sorry, so last week. And then I'm doing it next week. And when I do it next week, I'm in addition to the injections of those, the chemo drug, the skin cancer drug, and my own proteins. They're also going to do a they call it PEF, and it's electromagnetic. And what that does is it's going to explode those cells and kill those cells. So instead of having to do nuclear radiation on those sites that'll also affect my healthy tissues, they will kill the cells that way. And so what that does, and why we took so long to, we knew how important it was to find the right place, but also the order in which you do things is really matters. So some people, they do surgery first, then do chemo. They don't need to do radiation. But the reason why, the one thing all the oncologists agreed on is I needed to do chemo, then radiation, and then surgery, because to shrink down what the surgeons would have to remove. And so this way, by killing those tumors now, it shrinks it so the surgeon has a better chance of removing what they need to remove. Also, 2 of my lymph nodes aren't operable because they're underneath my collarbone next to some pretty major veins and nerves. And so they wouldn't be able to remove those with surgery anyways. So it's really great having that option as well. In addition to that, by killing it slowly and in a targeted manner, and by flagging my immune system, it's teaching my body to wake up and recognize it as a foreign body instead of just kind of tolerating it like it has been. Because everybody has like cancer in their body. Cancer is an autoimmune disease, and for whatever reason my immune system either gave up or just never decided to recognize it in the first place. So this is training it to recognize it and also kill it in a targeted manner. And so because of CIPI and because of the microdosing of chemo and in addition to all of the immune support that they do to help keep me healthy so I can fight this and so I don't have like lifelong side effects for the rest of my life, that's why we uprooted our whole lives and brought it to Arizona, to the hot desert. I mean, it is beautiful in like a rugged, desolate kind of way, but it's hot. And that's what, and the tricky thing is too, because it's not FDA approved, insurance companies don't have to pay for it. Like there's a couple of things that, because they're being used in like a standard way, like Lupron, and some of my oral chemo, and all my blood panels that they run every week, that is covered by insurance, but like CIPI isn't, because they haven't gotten FDA approval, and they're using drugs. What's crazy is they've run tests to show that my body does respond to this treatment. Like my cancer cells are killed by this. They tested it, and yet because it's not FDA approved for everybody, insurance companies don't have to pay for it. But anyways, that's why we picked Envita, and that's why we're here. And we're really happy. It's also the different environment too. Like you go, like everybody's happy to be there, and like the people in there doesn't look like an oncology waiting room. Like we went to a lot of oncology waiting rooms, and the people there don't look sick. And the people who are kind of like, you can tell are having a hard time, they didn't go to Envita first. They went to mainstream chemotherapy that either didn't work or it came back, and now they came here. So we're very optimistic. Everything's going pretty well. Oh, and another side note about Envita that's pretty cool was, like, obviously through this whole process, Donovan and I are like religious, and God's been a huge solace and kept us going through the other hard times in our life, and that's really held true for here. and it was such a big decision with so like financial repercussions and like like moving away from our whole family, like all of our support and our friends and our home with our animals and our, you know, a huge lifestyle change. And homeschooling Clara, like it's a lot. It was a big change. And we're just trying to find peace of mind and affirmation, right? That this is where God wants us to be. And it's not like it's not like a Catholic hospital. But you walk in, and the first thing I see, like right above the lobby desk, is a picture of Jesus and Joseph. And then they don't just have crosses; they have crucifixes. And then in one picture, they have the blessed, the Sacred Heart of Jesus, which is a specific like Catholic imagery. So that was just really affirming too, and gave me at least a lot of peace of mind that, yeah, like logically I know this is the right decision, but then just having that peace of mind, like there's pictures of Jesus where I didn't expect there to be pictures of Jesus, so that was really reaffirming. So yeah, and even then I was still like, Donovan, well, like you know, Fred Hutch, like they took the bad chemo away, we wouldn't have to move. And Donovan just kind of summed it up when he said, you shouldn't make lifelong health decisions, like your life, based off of what's convenient and cost. Like you need to do what's best, what we think is best, and what I think is best too, and what's holding true. Like I feel pretty good so far. It's been easier than the first trimester of pregnancy. I've definitely been tired. There's been 3 days that I've been kind of nauseous for a couple hours, but I've only taken the anti-nausea medicine one time. So pretty good, and I'm not in pain, really. No headaches, no body aches. Oh, but she said, I've had enough, my turn. Oh, I know. Are you the happiest little girl? Yeah. Were you upset because you couldn't see yourself? Fine. Okay, enough of that. And thank you for your time, and thank you for caring. Bye.